Hello, everybody. Olá, pessoal, tudo bem? Hoje temos aqui uma convidada super especial, uma convidada internacional. So we have here a very special guest, international guest, that is Dr. Hassan, my good friend Anhar. E hoje vamos falar um pouquinho sobre sintomas desautonômicos na doença de Parkinson. Vocês, como vai ser em inglês, vocês podem ver depois, colocar as próprias legendas no YouTube automáticas. So, the interview in English, of course, but you can put your subtitles and the language that you want. So, Anhar, so very nice topic that I really want to discuss with my patients in clinics are dysautonomic patients, dysautonomic symptoms, sorry. We know that Parkinson's patients can present with a lot of dysautonomic symptoms, as well patients that have typical Parkinsonism. But we focus here in Parkinson's disease. So can you explain a little bit how and why these autonomic symptoms occurs in Parkinson's disease and how common they are?
Okay. Hi, Mariana. Thanks for having me on your program. So I think, so autonomic symptoms, let's just explain what these are. So these are problems with blood pressure control, where the blood pressure can fall down or become low when people sit up. Typically, people feel lightheaded or faint. Bladder problems, where people lose control of the bladder, troubles with erectile function in men. So they're the most common kind of autonomic symptoms. And then there's a few others, like some sweating, excessive sweating. Or loss of sweating, and sometimes bowel symptoms as well. So these tend to reflect some problems with the autonomic nervous system. And some of the autonomic symptoms are not uncommon in Parkinson's disease. And part of it's to do with Parkinson's disease itself, having effect on the autonomic nervous system. Some of it is a side effect of medications that Parkinson's can also cause some autonomic symptoms. And it's also important to keep in mind that there is some cousin diseases. There is a specific cousin disease to Parkinson's disease where autonomic symptoms are really prominent. They're very, very problematic, and they overshadow the Parkinson's symptoms. And in that scenario, it's important to think about maybe this is not Parkinson's disease, maybe it's a different disease. And those conditions, one is called multiple system atrophy. There's another one called dementia with Lewy bodies, where there's prominent autonomic features. So that's kind of the scenario.
Okay, yes. And then some patients believe that this autonomic problem, occurs only in the advanced patients with Parkinson's disease. Do you see that early diagnosis patients in the beginning of the disease, first stage of disease, can happen as well?
Yeah, I think for Parkinson's disease, it's very uncommon. So that's things like so if we're talking about Parkinson's disease, what tends to happen is people get slow, stiff, shaking at the earliest symptoms. And then later on, they may develop some problems with low blood pressure and develop some problems with the urinary control as well. Urgency, they have the urge to go, they have to go right away, or frequency, where they're going very frequently. Very rarely do we see incontinence of the bladder with Parkinson's.
Yeah.
They're the main autonomic symptoms. And the bladder symptoms might occur earlier in the course, but they tend to become more pronounced as the disease goes on. The medication used to treat Parkinson's disease, specifically levodopa or dopamine agonist drugs, a side effect of that is they can lower the blood pressure. And they can aggravate that. So if people feel lightheaded after starting these medications, they need to increase their fluid intake, increase their salt intake to try and compensate and boost the blood pressure, compensating for the side effect of these drugs.
Yes. I have a lot of challenging patients that they need the levodopa, but they have the hypotension, and then just with these measures of drinking or any other medication to increase the blood pressure, sometimes is not enough. So yes, I think it's a very challenging patients. And I agree with you that hypotension or urinary problems are the most frequently symptoms. And as well, I have some young patients that complains about sweating or about this temperature dysregulation. They feel a lot of cold, they feel a lot of hot. So I think that the temperature regulation as well can be included in there. And we know that is because of the autonomic system are not regulated the same way. So in these patients that they have those symptoms, so we have treatment for that, right?
That's right. So for like the low blood pressure, if that's a problem, that can be treated fairly straightforward fashion. So drinking a lot of water, adding salt to food, that will help blood pressure. If people still feel lightheaded, then other non-medication strategies can be used. So that's wearing tight compression stockings, wearing an abdominal binder, which is like a tight belt binder around the waist, can help squeeze the blood vessels in the tummy and help push the blood up to the heart, up to the brain. And then there are medications, as you mentioned, there are medications that can be used to specifically boost the blood pressure. Some of those simply prevent the blood pressure from going too low. Some of these actually will increase the blood pressure. So the types of medications that are selected depends on whether the patients also have underlying high blood pressure. Because some people can have high blood pressure and then they stand up and their blood pressure drops down. So we have to be careful that we're not worsening coexistent high blood pressure with the treatment for low blood pressure.
Yes, exactly. Sometimes you need to reschedule cardiology, you reschedule how they take those medications and sometimes take it out in the course of the disease. Yes, okay, great. I think you...
Oh, I was going to say...
No, go ahead.
I was going to say for the bladder symptoms, if it's urgency, frequency, oftentimes, patients sometimes are happy just to not take anything for those symptoms. But if they're very bothersome, there's medication that can be used to reduce the need to go to the toilet so often, to urinate. So there's different types of medications. Some of these are potentially can cause the side effect of affecting cognition. So we tend to be careful with using those drugs in older patients or patients if they also have some cognitive impairment as part of their Parkinson's disease. There's more drugs now that are available that don't tend to cross into the brain and cause those side effects. But just there are treatments for the urinary symptoms.
Yeah, I agree with you. Yeah. As you see, Parkinson's disease is a very huge syndrome that can cause symptoms a whole body. So, but this depends. Each patient is different. Each patient have individual symptoms, individual progression of the disease. So, not that everybody will have all of the symptoms. So, I think this is the beauty of Parkinson's, that each patient that comes to us is totally different patient, different picture, and we need to treat this patient very individualized. So thank you so much, Anhar. I think you gave us a very interesting information about autonomic symptoms. And thank you so much for being here. It was a pleasure for me.
Thanks for the invitation.
All right, bye-bye.